Advisory Committee, Ministry of Health, and the National Task Force are currently analyzing the risk matrix and information provided by the different ministries, departments, and agencies to offer guidance on which sectors are ready for reopening or even closure where already opened if non-compliant to the standard operating procedures based on the levels of ongoing transmission of the disease. It is important for the sectors to appreciate that whereas a decision was taken by the National Task Force to open up those sectors under Phase 1, transmission had not been optimally controlled. As a result, there is still ongoing transmission in the community that, if not handled appropriately through decongestion of public space, the outcomes may affect the control of the pandemic. Specifically, any laxity and careless approach might lead us into a deadly third wave. By following these scientific principles, Uganda has only experienced 2 waves of the COVID-19 pandemic, while most countries around the world are either in the 3rd or the 4th wave. Rapid Assessment Survey. The Ministry of Health periodically carries out rapid assessment surveys to understand the prevalence and risk factors affecting COVID-19 in the country. As you may all recall, the first rapid assessment survey was conducted in April 2020 and provided information to guide our programming during the phased lifting of the lockdown. The second rapid assessment survey was conducted at a time when the country was experiencing sporadic cases in the community to determine the extent of community transmission of COVID-19 and the possible risk groups. Similarly, the Ministry of Health is now set to undertake the 3rd rapid assessment survey to generate local evidence to guide the national COVID-19 response. The objectives of this survey are: 1, to estimate the sero and viral prevalence of SARS-CoV-2 or COVID-19 in Uganda. 2, to estimate the proportion of the population exposed to COVID-19 by region in Uganda. 3, to compare the performance of the COVID-19 rapid antigen diagnostic kits and the PCR test kits at population level. 4, to explore factors influencing the acceptability, that is willingness and non-willingness to be vaccinated, and other preventive measures by region in Uganda. Furthermore, this rapid assessment survey will determine the distribution of the COVID-19 variants in Uganda, compare seroantibodies and correlates of protection among vaccinated and exposed individuals, and explore the COVID-19 home remedies used in Uganda. I'll now give an update on the COVID-19 vaccination. Uganda has received a total of 2,024,280 doses of the AstraZeneca and 300,000 doses of the Sinovac vaccine to support the mass COVID-19 vaccination exercise. As you are aware, government is using a multi-pronged approach to secure adequate vaccines for the target population of 22 million people, 18 years and above. The following options are being used to access vaccines from the global market: purchase through the COVAX facility, purchase through the African Union, purchase from manufacturers, and donations through the COVAX facility. A technical interministerial committee, also known as the Vaccine Acquisition Committee, was approved by Cabinet, sitting on the 19th of July 2021, and members of the committee were subsequently appointed. The committee was established to guide decisions with respect to direct sourcing of vaccines. The committee is chaired by the Director General of Health Services and assisted by the chair of the Vaccines Advisory Committee. Other members include representatives from the Ministry of Finance, Planning and Economic Development, Ministry of Foreign Affairs, Ministry of Security, and National Medical Stores, with the Secretariat being the immunization program. Specifically, the role of the committee is to review expressions of interest to supply the COVID-19 vaccines based on the following criteria. 1, the profile of the company. 2, relationship with the manufacturer of COVID-19 vaccines. 3, the quantities that can be acquired through the agent. 4, the earliest date of delivery and period within which the supplies can be received. 4, the unit cost per dose. And 5, the modalities of payment, time frame, and who to be paid. Uganda, just like other countries across the world, requires adequate vaccines to ensure that her population is protected against the deadly disease and enable the economy to open up. Basing on this need, a number of companies expressed interest to supply vaccines to the government of Uganda between June and July 2021. By the end of July 2021, a total of 10 proposals had been submitted to the Ministry of Health, and these were reviewed by the Vaccine Acquisition Committee. However, none of the proposals had evidence of direct linkage with a manufacturer, which was a major requirement. The committee resolved to purchase vaccines through known and reliable sources. That is the global sharing mechanism of COVAX and the African Union. Subsequently, cost-sharing agreements for the donations have been signed and expression of interests to procure from these entities confirmed. The ministry now awaits to agree on the delivery schedules of vaccines from the COVAX facility and the African Union. To this effect, 9 million doses of the Johnson & Johnson vaccine from the African Union to cater for 9 million people. This is expected to begin arriving in the country next month, September 2021. 3, the COVAX facility has committed to provide donations of up to 18 million doses to cover 9 million people. These developments align our pipeline expectations to cover the 22 million target population plus the additional population of children. As of today, a total of 1,670,951 doses of the AstraZeneca vaccine have been administered to the population countrywide. 934,813 people have received the first dose, while 333,138 people have received the second dose. Vaccination of the population will continue based on availability of vaccines. All eligible persons will be vaccinated. The population is urged to be patient and wait for guidance from the Ministry of Health. Clarification on fake vaccines. The ministry has noted some false and misleading articles titled "Serum Institute Confirms Fake Vaccine Batches Supplied in Uganda," categorically state that the government of Uganda has not received any falsified vaccines from India. We would like to clarify as follows. 1, the Covishield vaccine supplied to the government of Uganda from the Serum Institute of India was genuine and approved by the World Health Organization and the National Drug Authority. 2, the vaccine is administered through the Ministry of Health designated COVID-19 vaccination sites. 3. In July 2021, during their routine pharmacovigilance activities, the Health Monitoring Unit, working with the security personnel, identified and arrested unscrupulous individuals who were trying to falsify the vaccine batch numbers using the Serum Covishield brand. 4. The individuals were detected and arrested by our strong systems in place. 5. Further investigations, which included biochemical tests, revealed that these malicious individuals injected unsuspecting people with water, but branded as Covishield vials. Therefore, the ministry would like to reiterate that all vaccines administered to the population through the designated vaccination sites undergo scrutiny before being administered to the population. The vaccines are safe, effective, and free of charge. Conclusion. As we follow the evolution of the second wave with anticipation of a phased lifting of the lockdown, I appeal to the general population to continue following the COVID-19 standard operating procedures. It is in our hands to prevent the third COVID-19 wave. We all witnessed the magnitude of the previous waves. Let us be vigilant, protect one another, and get vaccinated. I thank you all for God and my country.
Thank you so much, the Honorable Minister, Dr. Jane Ruth Acheng, for your address to the members of the press who are here, I think, excited to also ask a few questions. If you are there and you have a question to ask the Minister, please, you could come up, do it very briefly. We shouldn't have very many questions in the interest of time. Is there anybody with a question before we get to what is on social media? Thank you so much, the Honorable Minister. And one, the revelation that we're expecting these doses of vaccines by these timelines, I think also helps the nation too run away from the vaccine apathy that possibly would slide into our communities. But when we hear from you, of course, we have doses coming in from Sinovac, Johnson & Johnson, and from the COVAX facility. I think this should be answered to us by Dr. Wayengera. The mix of the vaccines. The last time you were here, you told us which are actually good to do the mixture. But you noticed that the vaccines are also made from different materials. The mRNA and the other, which is also called the adenovirus vector. What about if we just rush into all of these without knowing which ones to mix? What happens to that? And maybe the other question is about the immunocompromised persons. The question is, are the two jabs adequate for those who have the deficiencies in their immune systems? Any question from out there? Or we, okay, thank you. Just step up here. Tell us your name, make it brief, and the ministers will be able to respond. Tell us your name and the media house you're representing.
Thank you. My name is Patrick Onen. I work for the Associated Press. My question is to the minister. We've seen developed countries like America, they're calling for a booster shot. What is your comment about these countries that are still holding on to these vital vaccines that is supposed to help countries like Uganda?
Thank you so much, Onen. And Onen's question actually complements my immunocompromised persons because I think those are the ones that need the boosters. Yes, come tell us your name, Rakisha, and make it as brief as Onen did his. Then we'll ask Dr. Wayengera to help us. We should be done in an hour's time.
My name is Patias Karikona, working with UBC. And at the moment, I'm shooting 3 documentary films on this COVID-19. But my question has always been, there is, maybe it's me who is blind, But most of the policy makers, when they come here and they start appreciating the way they look at our observance of SOPs, it beats my understanding when I hear that the SOPs have been highly valued and observed, yet from home up to here, the first mask, I find it at the gate entering UBC. The rest of the way, either they are neckties or they are putting it in the head. I don't know whether that is the proper way of putting the masks. The second question, which has always been disturbing me, is the issue of children. Always whenever they are saying the next batch is coming into the country, you hear the age, either 39 or 29, 59. The last one I'm hearing is 18. And it sends me to think, yet these children under 18 are the ones who play about with hands here and there everywhere. They are the ones who are playing football. I see them riding, what are these, tires of motorcycles. And I'm wondering whether they are getting some kind of emphasis when it comes to the next vaccination. I wish they were to be given priority before the adults. Me, myself, I finished the 2 doses, but the children is my issue.
Okay. I thank you so much. Yes, you will be the second last if there is one more. I cannot allow for one more question.
My name is Shamim Nawakoza. I work with NBS. My question is, how far are the discussions for immunization of children and also the school-going children? There's a call from the First Lady to immunize or give them priority as the vaccines come into the country. Thank you.
Any more question? Nothing. This has come in from somebody saying accreditation of private health facilities to do COVID testing. How is this done? Number 2, why are some service providers or why are some providers removed? Number 3, some were said to have breached the contracts. Was there investigations done to this, and what did they reveal? Another is, same person, of course, asking different questions. What are the penalties apart from being stopped from conducting tests? What other penalties apart from stopping them? And maybe the final one would be about the fake vaccines, which you talked about, Honorable Minister. You may just emphasize if you so wish, but you had spoken already about the fake vaccines. This is from Walter, who is not here. Emma, do you have some questions? No questions from you. Okay, I just guessed, and no more questions from the members of the press present here. I will invite you, Dr. Waingira. Attempt those that you can attempt, then you send to the minister what belongs to her. Thank you. No, just, Honorable, Doctor, just get here. Just step there.
Okay. Thank you, Jagenda. I have 7 questions here that have come from the public. The first question coming from you regarding the mixing of vaccines. The Scientific Advisory Committee working with the Makerere University researchers is already in the process of getting a protocol approved to study the options for and possibility of mixing vaccines. And we are doing this cognizant of the fact that so far the only study that we have for mixing of vaccines safely involves the AstraZeneca vaccine and the Pfizer vaccine. There are no studies yet regarding the mixing, the potential mixing of the other vaccines. And that's the reason why we will undertake those studies. Are there 2 doses, are 2 doses sufficient for those who are immunocompromised? I think that one of the things, vaccines work by eliciting the immune system. And in context of immunocompromise, certainly there might be need for additional boosters, largely because the arms of the immune system that are supposed to be elicited might be compromised. But again, to the extent of, to what extent that will be necessary is a subject of study, and hopefully our researchers will take up this and address this. The developed countries are calling for a third booster dose, and of course that is happening because of the rise in infections among those that have been vaccinated. Yes, that is true. What is our position? I think our position is the same as that that the WHO has taken, requesting the developed countries to hold on this decision to undertake third boosters so as to make vaccines available for the other part of the world. And this is largely because we will not be able to effectively control the COVID pandemic unless we vaccinate everybody globally. If you leave pockets of unvaccinated people in sub-Saharan Africa, there are chances that new variants could emerge from here that might threaten the health of the people in the developed world. The issue of observance of SOPs and why they are not being followed. I think that this is an issue that largely comes from our culture and norms, but also it is the reason why we end up taking the authority away from the people by instituting lockdowns. When people are compliant to the SOPs, we are able to work together to control the transmission dynamics. When that fails, we are left with no option but to take harsher restriction measures. And as you know very well, we have so far undertaken 2 lockdowns, and hopefully the public this time around can work with us by complying to the SOPs so that we delay any need for further restrictions. The strategy for vaccinating children, how far is the concept of immunizing children? I think that this is a dilemma, particularly because of the slow rate at which we are acquiring vaccines. But what I will tell you is that the original studies that evaluated vaccines, the safety and efficacy of vaccines, did not include children who are under 18. And this was largely done to follow the ethical guidelines that are present at the global level. The similar thing happened by exclusion of pregnant women. You know very well that we are just now starting to get studies to point to the fact that it is possible to safely vaccinate children. Which vaccines to use is also another thing. And so that probably will be undertaken as we generate more data in this direction. The issue of accreditation of private facilities for COVID-19. Why are some removed? I think the process for accreditation is a very robust process. Starts off with a site visit to literally look at the readiness of the facility. The facility is advised on what should be improved. In the process, the staff of the facility are engaged for training on what they need to do, and subsequently the facility is externally validated in terms of being sent samples that are pre-qualified, and they test them independently. So this process does not take a single day. It takes several days, and by the time a lab comes to this point, we assume it's ready to test. Of course, the issue of maintaining standards is not a one-time thing as well. You need to maintain standards at every point. And unfortunately, some of the labs are found to be deficient of these standards, and decisions are taken to close these labs. Yes, investigations take place. The results of those investigations, I think, are largely private to the decision-making authority, and that's the Director General. But investigations are undertaken. Honorable Minister, I don't know whether you want to talk about the issue of fake vaccines, but certainly this has been a rumor, and I think I should leave that to the Honorable Minister to speak about. Thank you.
Honorable.
Thank you very much, Mr. Jagenda. I gave a comprehensive statement, including on fake vaccines, so I'm not going to talk about it again. And the rest of the issues have been addressed by the chair of the scientific committee. Perhaps what I will only comment on is I will give something to add on to accreditation of labs. Most of the labs that we accredit forget that there is what we call continuous quality assurance, where the labs that have been designated to do this continuously assess the laboratories. Sometimes they relax and forget to maintain quality, and when this is detected, then measures are undertaken. So I want to encourage the labs that have been accredited to ensure that the initial standards that were communicated to them from the very beginning are maintained, so that they don't fall victim to some of those challenges that we experience. Why do we thank people for observing the standard operating procedures? It is not true that everybody does not observe the standard operating procedures, and you must give due credit to those who are actually observing the standard operating procedures. It is a motivation for them to continue. And for those who are not observing the standard operating procedures, we must continue to emphasize until it gets to the minds of everybody that it is important to observe standard operating procedures for us to protect ourselves. The cheapest vaccine is the standard operating procedures. It is widely available, readily available, cheap, free of charge. Wash your hands, maintain your social distancing, wear a mask. That is cheap, and it protects all of us, and it is easily done by each and every one of us. And I will continue to appeal to the population. If we don't observe the standard operating procedures, the third wave will come sooner than later. And as I already mentioned before, the third wave will peak at a higher level. The scientists have predicted 4,000. That is 2 times higher than the second wave, which means it will be more aggressive than the second wave. It is therefore important that we take heed and follow the standard operating procedures. So lastly, Mr. Jagenda, allow me to appreciate the population and to continue to appreciate the chairs of the district task forces who are taking care of the activities in the various districts. I will also continue to appreciate the different ministries, departments, and agencies because we work in a multi-sectoral manner. Lastly, allow me to appreciate my voters of Lera City. Luak me Lera City, apuoyo wunomate kamoro wudushu, inying Yesu Kristo, dohate puoyo wu totwal, pigwahere kofi kom tuo ideheni. Dohate mede kwayo wuni, utemuni tek wadushu, metuo ideheni, pechak mede Lera City. Pien wano beru jo ame winyu kop, dang teni angaber, te lobo ateni mere. Puoyo wunu chunga tek, puoyo wunu lego, pingara chela cheli langeri, kere lobo standard operating procedures, achwechi poliko kome guokwu. And to the people of Uganda, God bless you all.
Thank you so much, the Honorable Minister, and thank you so much, all of you there. We had a few questions coming in, but we'll not ask the Minister to answer more questions. These will be answered in different platforms and maybe some other time. Thank you so much, Honorable Minister, and thank you so much, Honorable Ministers, and thank you so much, Dr. Misaki Wayengera, representing the scientists there. And to the press, we thank you so much. My name is Jagenda Semakula Zikusoka, just wishing you a very blessed evening and a blessed weekend for God and my country. Good evening.
This weekend on UBC.
Achieving something can be a widely exhilarating thing in life. But then if you're flirting with the idea of giving up, you could be throwing up something very important. This man I have on the show has been dragged through murky waters of politics, through everything, but he has turned out to be very victorious.
Yes, he just come back to the SEC after a leave of 5 years. I'm back, and definitely Kampala needs a vibrant leader like me